Hi, I'm Meshal Malik, and you're watching Indus Special. Policy experts and human rights organizations are continuously reiterating the fact that the pandemic will hit already vulnerable communities the hardest. Amongst those marginalized and disadvantaged groups are the millions of refugees across the world, living in cramped camps with little to no healthcare options. On the show today, we take a closer look at how the politics of migration is intersecting with this health crisis. Joining us for this today is Mr. AliReza Yasa, who is a refugee and human rights activist joining us from Turkey. Also joining us today is Mr. Adrian Pereira, who's the director of North-South Initiative, which is a youth-led initiative which primarily is missioned to empower marginalized groups. He joins us from Kuala Lumpur. Thank you both for joining us and welcome to the show. Mr. Adrian Pereira, I'd like to begin with you. Now, we know that refugees and migrants are some of the most disadvantaged in the world today. How are we seeing this pandemic impact them uniquely, especially when we look at the examples in real time?
The migrants and refugee communities have never really had an opportunity to be socialized into community where they gain or experience the benefits of citizenship and also other social aspects. So that marginalization has now caused them to experience further stigma and also become victims in the forefront of in facing this new virus. So at the global level, each issues are very separate and distinct. So you have the health of refugees and migrants, you have the economic aspect, then you have the competition for resources and aid with the locals. So it becomes very complex, and now we are seeing all the problems come to the surface. And I think we need to be very smart in how we handle this.
Right, definitely. We need to be very smart in how we do this. Talking a little about what's happening in the conflict zones. Now, we heard earlier on the United Nations chief urging countries to halt conflicts, to try to seize what's happening at borders, to try to ease the situation given the enormity of the pandemic that we're dealing with. Have you seen any outcomes? Have you seen any defrosting of those situations? Have you seen any of those factors driving these millions of people out of their homes, seize momentarily even?
Yes, a few days ago, both carrying the Rohingya community, they were pushed away by the Malaysian armed forces or Navy. So unfortunately, in their mind, they don't want to take further risk of having people who could be infected come into the country. But actually, what they fail to understand is when you push people back, traffickers and smugglers take advantage, and they still will find a way to come on shore. And we then lose the opportunity to screen the community on board if they are infected with this COVID-19 virus. And that puts everyone at risk because when they land and they start socializing with the general public, it becomes worse. So now is not the time for governments to put up barriers. These barriers will backfire on us. Now is the time to include them in every aspect, be it aid, be it the basic security, and even the random testing. We have to include everyone because the virus doesn't discriminate.
Right. Stay with me on that point. That's an point you talked about, the borders and trying to make communities more inclusive for these refugees and migrants, especially when we're talking about targeted health policies. Mr. AliReza Yasa, now we know that before this pandemic became fully blown, there were tensions in the Turkish-European border. We saw refugees try to get to European borders after Turkey opened its borders for them to move along. What has the situation, how has the situation progressed and unfolded on that front?
This opening border was from only the side of Turkey government, not from European or any other countries. The Turkey government announced that they will open their border for refugees. They can go to the Europe, through the Europe. But the Europe doors was closed. Even they tried to make it closer, and no one could pass from the borders. About 1 month, those people, about 20,000 refugees stayed on the border under the rain in the bad situation. After that, the Turkey government, when the pandemic issue, the illness, the coronavirus made the situation more worse. Because of the danger of this virus, the Turkey government decided that these people, these refugees, must return to their homes. Most of them turned back to their homes. The people made a percentage, those who had houses, those who had shelters in Turkey cities. But most of them by government, they brought to some camp, to the refugees camps. There was a very bad situation in these camps, but the Turkey government decided quickly and distributed to the many cities these refugees. The refugees, now they are under control, and now the situation is better than the first days of this pandemic illness in Turkey.
Can you take us through some of the policies that are being adopted at the point in regards to how health policies are being given to these refugees, especially as you're saying that the situation has gotten better than before?
Actually, inside the cities, when you look at the policies of the government, for example, every single municipality has some rules to support the people who are not as much rich to have their everything when they are staying at house. The people who are working, the social workers, the people who have to go to the bazaar, go to the society and work and bring some food for themselves every single day. They had some policy to support these people. There is no discrimination between the poor people of the society and the refugees. That's why the situation is under control, and there is no difference between the refugees and citizens.
Right. Mr. Pereira, Mr. Yasa brings up social workers who are responsible for going out for these outreach programs targeting refugees, going to them, trying to handle the situation in the best way they can. In that regard, what are some of the protections that are needed to be provided to these workers globally?
In terms of protection from the virus itself, they need to be included in the testing. They were, for many years, different countries looked at migration and refugee situation as a security issue. So it comes with a lot of stigma. It comes with a lot of fear. So many refugees and migrants, especially those without documents, will be very afraid to come forward for this testing. So it becomes a challenge for governments in managing COVID properly. And this is the time to desecuritize the issues. We need to look at everyone as human beings, because the moment we add in layers of security, of right-wing politics, it's going to backfire. So globally, I think we need to rethink the whole way of how we look at migrants and refugees. And health is only one small impact of the devastation that could be caused. We shouldn't forget that the whole global supply chain is also going to be terribly affected.
Right.
And migrants who are part of the labor force will play a big role in rebooting the economy later. So it's very important that we take care of everyone now, regardless of locals or their immigration status. And later on, as time goes, work together to reboot the global economy.
Let's try to pick up on that a little more, Mr. Pereira, how these migrants, how these refugees will be contributing to the rebuilding of the economy. Even as we see right now, how are they contributing, especially when we talk about providing medical professionals to different countries? We know that we recently saw the example of the Cuban doctors going around. People from these regions have been demonized by many of the developed countries as being a burden. How are they contributing during this pandemic?
If you look at the Malaysian example, many sectors have been depending on migrant skills, migrant labor. So, for example, the production of rubber gloves Malaysia is one of the big global contributors, and migrants are now playing the role to make sure that to fulfill the global demand. But later, in different sectors, for example, palm oil, manufacturing, the global demands may be slower, but to kickstart new sectors, we will definitely need their labor, even for locals. So I think we should be taking care of everyone now. If they are sick and if they get into difficult working conditions, it's not going to help everyone.
Right. They need to be helping everyone in this regard, as you're mentioning here, the contributions that they will be giving throughout this. Now, let's talk further about what's happening in terms of the global cooperation in trying to support refugees. We know that a majority of them are being housed in developed nations. We have also heard of pledges by the United Nations, appeals of $33 million. Antonio Guterres talked about $2 billion possibly. What is being done with actually providing these funds, with actually gathering these funds, not just talking about them as pledges? Mr. AliReza Yasa, what more can you tell us about that developing situation?
If I talk especially about the Turkey government, which they discussed politically with the European Union on the migrant and refugees crisis in Turkey, you may know it's getting better. The situation of the relations of the countries are getting better. But at the main time, in real life of refugees, there are crises going as well.
Right. Mr. Yasa, specifically about humanitarian aid, we know that Turkey houses the largest number of refugees in the world. What is being done by the global efforts to increase humanitarian aid during this time?
I think the globalization, it's a globalization crisis most affecting on refugees who are living in bad situation. They are poor. They do not have. They are not. Some of them are not allowed to go to work because of the limitation from the government, and this is a kind of crisis mostly affecting the refugees. That's why we need the globalization community to focus on this crisis, on the refugees problem, especially on the places, on the countries, the government have their own problems and they are also in the crisis. If there are some crises affecting on the people, on the humanity, it means most people who are in danger, they are refugees. That's why we need to mostly focus on refugees. May they are in the camps, may they are living in the cities with very bad economy and lots of problems they are facing. Even there are some places that they are facing discrimination by the government. They are not allowed to go to the hospital. They are not getting as much treatment that they need.
Mr. Yasa, let's talk more about that discrimination you're talking about. Now, you previously mentioned that there is no distinction between what's happening regarding an ordinary citizen and a refugee. Now you're saying that there is discrimination and very blatant sort in which there is a priority being given to those who are seeking medical help, especially when we're trying to create a distinction between an ordinary citizen, a naturalized citizen, and a refugee. Can you tell us the details of those sorts of discriminations?
The policy from the government, it is to no discrimination about anyone. But in real time, in some places, we have heard that some people, when they went for for treatment or they refer to the hospitals, they have not been accepted by the local or the hospital, may they are private or belongs to the government.
All right,
So
Mr. Yasa, stay with me. I also want to ask Mr. Adrian Pereira if he has heard of such incidents as well. Mr. Pereira, we know that refugees and migrants lack the social security that is needed for them to access healthcare. But as you mentioned before, this is a time if one individual carries the virus, it will reap havoc upon the entire society. We've been seeing that all across the world. So even in this instance, are we seeing discrimination on the basis of who gets healthcare treatment, who gets testing, especially when a refugee goes and tries to access this?
Refugees and migrants have a bit more difficulty in accessing healthcare because under the so-called lockdown conditions, the restricted movement makes it very difficult for migrants and refugees to come out and seek assistance. Of course, governments have welcomed them to come forward if they feel they have symptoms. But we all know the different social, political, and physical hurdles that they face. So if they are in a rural area, if their living conditions are cramped and located in the outskirts of towns, it makes it very difficult. And they are also very scared. But let me give you an example of a very big mishap or miscalculation by the government. And if you look at Singapore, they kind of like, maybe they were overconfident with their gold standard and they missed out on the migrants' hostile condition. And it was a ticking time bomb. It's something that just explodes and now things are out of control. So if you look at Singapore's situation, there were many red flags that have been raised in the past few months, and still these conditions were ignored. And I advise all governments to listen to what the refugees have been saying, listen to what the NGOs have been saying. You cannot neglect the situation anymore like before. It definitely is going to explode in your face. So include migrants, try to minimize as much discrimination as possible.
Right.
Here in Malaysia, I know that some policymakers are saying that the priority is still formulation. They just don't understand that you're dealing with a virus that doesn't discriminate and is going to affect everyone.
Right. The virus is clearly discriminating, but healthcare policies continuously are. Now, as you mentioned, the example of Singapore, talking about migrants being cramped up in places and those areas being neglected, we've seen 3,000 cases emerge over the past 3 days. This is not just an issue dealing with migrants or refugees. This really becomes a national issue. Why do you think we are still seeing governments pushing back on providing healthcare to these migrants and refugees? What are the main reasons for it? Is it a lack of funding? Is it the lack of facilities? What is it? Is it political rhetoric, do you believe?
Yeah, so the global right-wing politics has been emerging in the last 4 to 5 years. So any political party that's striving to stay relevant in the eyes of the public has to follow this very xenophobic and racist demand. So it comes from the people, it then translates into national politics, and that politics pushes for policies that discriminate. So now that we have seen, we have come to face a virus that doesn't discriminate, and there's no way that business can continue as usual. We have to stop this xenophobic and racist-based policies. It will backfire. Yes.
Right. Mr. AliReza, Yasa, Turkey being so close to Europe and having this a pact with Europe in regards to how refugees will be housed, how they will be transferred. What is the update on that given the current situation? Is there talks of greater funding, greater support coming in from the EU?
Especially in Turkey, there is no international funding special for this illness, for coronavirus. But we have heard that they are supporting some of the organizations like UNHCR about to help the people, to help the refugees. Also, in the last 3 days, there was a movement from Germany that they have they have accepted many underage refugees who are not with their parents, with their family. They have flown in last 3 days to the Germany. It's a kind of it's a kind of caring of the humanity and refugees from the European Union, especially from the Germany government. So in general, when we focus on the refugees crisis during this pandemic issue, there was no any different. Just the government must try. We hope that everyone, every communities, every people of the citizens give their hands together to solve this problem globally. It's not there is no as
right.
you said, there is no discrimination by the virus.
Right. But on that point, thank you so much, Mr. AliReza Yasa, joining us from Turkey, and Mr. Adrian Pereira for joining us from Kuala Lumpur. Now we're joined by Mr. Alexander Seale, who's a journalist, joining us from London. Thank you so much, Mr. Seale, for taking out the time and talking to us. Now, as we've been talking about refugee policies and migrant policies during COVID-19, how they're changing, how they're altering, and what stance different governments are taking. What is the on-ground situation within Europe at this point in time?
Well, in Europe, as you know, most countries have decided to close their borders. For example, in France, President Macron said in a speech a few days ago that borders will be closed, and that is to prevent the spread of COVID-19. And I'm in London, and in the UK, some flights have been cancelled, and so it's really disrupting people's lives at the moment. And also, so this coronavirus is a big change for everybody.
Right. Mr. Seale, now, how do we try to balance out that conversation between the humanitarian obligation to provide asylum to those who are fleeing conflict and to protecting your own communities from the spread of this virus, and especially people coming out from outside being potential carriers?
Well, I think the authorities have to work together, and I read an article in a newspaper called the New European, and saying maybe after coronavirus, a second referendum on Brexit could happen, because, as we know, that the UK won't be better off outside the European Union, and also helping other communities. And refugees also is an important thing, because it's an important aspect, because of course in refugee camps also there isn't a lot of information about COVID-19, and so people in refugee camps are vulnerable. So I think, first of all, governments have to find some way of trying to have proper information,
right?
Finding proper information about COVID-19 at refugee camps.
Right. Mr. Seale, it seems like we've moved beyond the point of gathering information and actually going to the point of damage control, providing relief, conducting rigorous testing, also treatment, isolation. Are governments facilitating that in refugee camps all over Europe?
Not that I know of, but in London, in the UK that I know of, that mass testing is, the government said that the deadline was 100,000 tests per day until the end of April. So
do those numbers include refugees and migrants?
we don't know the statistics yet because every day at 5 p.m. there is a coronavirus press briefing, and we don't have every day we know the statistics of how many people die, etc. But we don't know the actual statistics yet. It's too early to know. I think towards end of April we'll know something. But right now, for sure, that the numbers for 100,000 tests per day towards the end of April won't be kept promised.
Right. Right. On that point, thank you so much, Mr. Alexander Seale, for joining us from London. As Mr. Seale mentioned, that we don't know exactly enough about the stats on ground situation, and we will know as situation unfolds. But it is important to remember that these testing targets need to include the marginalized communities, those communities that are disadvantaged and continue to be disadvantaged during this pandemic. We're going to go for a short break, but stay with us, because when we come back, we take a look at how there is a resurgence of COVID-19 in countries in Asia, which had handled the virus well the first time around. Welcome back to the show. New cases of the coronavirus are now being reported in parts of Asia. Singapore, for instance, has reported 3,000 new cases in the past 3 days. And China is seeing new cases in its northwestern province. These cases are not just alarming for these nations. They are telling of what could be the possible trend in outbreaks across the world once the first wave is dealt with. Let's try to understand what's happening better on ground. Joining us for this conversation, Mr. Benjamin Neuman, who's professor and chair of the Department of Biological Sciences at Texas A&M University. He joins us from Texas. Also joining us today is Mr. Einar Tangen, who's an author, political and economic affairs commentator. He joins us from Beijing. Thank you both for joining us and welcome to this show. Mr. Tangen, let me begin with you now. Talking to us from the heart of the region, Beijing, let's talk about why we're seeing a spike in these numbers. Again, why are we seeing this trend unfold across countries which were applauded as handling the virus very well initially?
Okay, so you have to separate these three countries, all right? In China, what you have is people coming back across the border, particularly from Russia, who are infected, and they're being dealt with. In Japan, what you have is an indigenous population. It's not from outside people. It's just people within Japan who are getting it. And in Singapore, what you have is there are about 1.2 million migrant workers there, and they live in much more crowded conditions. And it's among these that the vast majority of new cases are. So you have three different conditions. China really isn't going through the second wave yet. We don't know if they'll be able to avoid it. And in terms of the other cases, other systems, Japan has been kind of going along. I think there is some concern. They extended the lockdown, what they call a partial lockdown emergency situation until June 1st. So it's obviously something they're concerned about.
Right. Mr. Tangen, you mentioned here China hasn't been going through the second wave as of yet. Whether they're going to be able to avoid it or not is a question for the future. But that really brings us to a very important point, which is how do we distinguish between the first and the second wave? There is a lot of conversation about it, but how do we know this isn't just the first wave extended? Mr. Benjamin Neuman, what more do we know about that?
We're starting to learn a lot of things about how the immune system deals with the virus. At the moment, we know that originally it was thought that people who recovered from this virus would probably have lifelong immunity. What we're finding now is that a reasonable proportion, perhaps something like a third of people who have mild COVID-19 actually don't develop a kind of antibody called a neutralizing antibody that would protect against subsequent infection. And so they would probably not be immune to a second case themselves. I think really, though, what we're looking at is just one big outbreak across the entire world. There aren't really different waves at the moment. It's just ebbing and flowing in different parts of the world, and it's all connected. Whenever anybody is sick on this planet, as connected as we are through air travel and just ability to move around, everyone else is at risk. And I think that's the key thing. Even some of the tests that are being proposed for screening, some of these antibody tests, there was a preprint that came out today, and it suggests that these tests have a very high false negative rate, meaning that they would not be able to detect antibodies in a lot of people.
Right. We'll talk more about why that's such a scary finding and what that means for the future. But I just want to read out a statement written by an associate professor at Johns Hopkins University who talked about the fact that this virus will probably infect 40 to 70% of the global population during its first wave, which might occur over 6 to 12 months or might be spread over a year. Is that what we're seeing, that this wave, the first wave, we don't know if there are second or third waves just about yet, but this first wave might last for up till that duration?
It's possible. I think this is a scenario that if things do not change, this is the outcome that could happen. I think this is assuming that places like the United States kind of stay open or reopen a little bit too soon, and similar things across Europe, similar things across other parts of the world. And really, it's a risky time to be doing that, especially with the uncertainty over immunity. There seem to be a lot of countries that are actually pursuing a strategy that looks as though the goal is something like herd immunity. And this may not actually exist. And so, yeah, this is definitely a concern. And those numbers are things that we should be paying attention to and making policy decisions based on, I would say, so that we do not end up in that particular situation.
Right. Mr. Einar, Tangen, now, as you talked about the fact that most of the cases that are testing positive are coming from people that are returning back to China. Now, what have been some of the policies of these people, of these citizens returning back to China? How are they being dealt with? How are they being quarantined? Are there, what is basically the stance of the government at this point?
Okay, well, the stance is uniform. They closed down anybody, foreigners from coming back. And they're taking about 3,000 people a day, Chinese nationals who can come back to China. And particularly those coming from Russia have a high incident of COVID-19 infection. For instance, there was an airplane that came into one city in China, and it had half, 80 out of 160 people were in fact infected. And they're seeing large groups who are infected coming in through trains and buses and also other airplanes. So what happens is you're immediately, when you come to the airport, they're sequestered, they're not mixed in with the general population. There are people who greet them are in hazmat suits. They're evaluated, their temperature is taken, they're given tests. They're taken to a processing center, and then if they're showing, or anyone in the flight was showing any kind of symptoms, they are then sent for a 14-day mandatory government hotel where they stay. I've had many friends who have done this. They've complained a little bit about the food, but actually, in actuality, they're actually using hotels. These are not prison centers or anything like that. So people stay there for 14 days. That's absolutely mandatory. The question is on the evaluation whether they need to send you to some sort of emergency care based on the fact that you were infected.
What is the situation like in terms of local transmissions? Has that already started happening within China?
Very, very few. There have been two pockets. There was one person in Beijing who, and this has not been confirmed, supposedly one person who was walking around and may have infected others, but it was quickly jumped on. I mean, within a matter of a day, there was, they were out actively canvassing and following and tracking down all the people that this person had been in contact with, and making sure that they were sequestered for a 14-day period. And then there was one in another province in Hubei where there was some outbreak. There's 3 or 4, and they're dealing with it the same way. So I wouldn't say that this is a second wave. I would agree with the doctor that this is probably part of the first wave. Now, remember, a lot of the things we know about this virus are different from the Spanish flu and others. We are at a different time. We have different technology. The Spanish flu was 50 million people dead, and it was basically 18 months and 3 waves. And the second wave, unfortunately, was much stronger and more deadly than the first wave. In this particular case, hopefully, it will not be that case. But, right now we hope for the best and prepare for the worst.
Right, Mr. Neuman, just a question to you. Do you feel like this is a misplaced comparison? As Mr. Tangen is stating, this is very different from the Spanish flu. And many people are talking about how the second wave will be more deadly than the first, given that pattern, given that example of the Spanish flu. Do you agree that that's a misplaced example?
Not necessarily. So the Spanish flu is not the same type of virus, and the world is very different than it was 100 years ago. But at the same time, I think what we need right now, and what I don't see consistently across the world, is for people to take this seriously and governments to take this seriously and act accordingly. Nothing less than all-out vigilance by absolutely everyone is going to be needed to actually stop this outbreak. And right now it's a little bit patchy. And so I would like to see a little bit more. I'd like to see people actually consider this to be deadly, like the Spanish flu, even though it's a different sort of virus. And statistically, it's probably not going to play out quite the same way. I think this is still a very large tragedy and an avoidable tragedy. And even all the deaths that have happened up to this point, I think won't be in vain if we can shut down this virus right now and avoid that second and or third wave.
Right. Now, just to that point, I want to a statement made by the Director General of the World Health Organization, who made this prediction of where we stand right now and what we can expect in the coming future.
The worst is yet ahead of us. It's a virus that many people still don't understand. We have spoken previously about the factors countries must consider as they plan to start lifting the so-called lockdown restrictions. We want to re-emphasize that easing restrictions is not the end of epidemic in any country. Ending the epidemic will require a sustained effort on the part of individuals, communities, and governments to continue suppressing and controlling this deadly virus. Early data from some of these studies suggest that a relatively small percentage of the population may have been infected, even in heavily affected areas, not more than 2 to 3%.
Right, and Mr. Tangen, now picking up from the several points that the Director General mentioned here, one of them is the fact that easing restrictions does not indicate that this epidemic within a region is going to end or that it is ending. What are some of the things that you feel are going wrong when we talk about countries like the United States or UK or parts in Europe where this is quite very early on, and we're seeing a number of cases spike up? Talk about easing restrictions.
Well, the problem is not listening to people like Dr. Neuman on the show. This is extremely serious. I was not trying to belittle it. I was just saying that we have different tools. We can track people and things like that. But what you have here is people are mixing politics and other agendas with what is a health tragedy. And that is extremely dangerous. People are talking fascistically about, herd immunity. Well, herd immunity sounds great, except we don't know that it works, as the doctor pointed out. And second, if it's you or your family that gets, quote, culled from the herd, I don't think you feel the same way about it. This kind of casual attitude that the economy is everything and that people are somehow, it's okay to have a few casualties in there. It's just collateral damage. I think that's what's really wrong with the world and many of these politicians who are pushing this. I think it's extremely, they're elected to take care of the people, to do their utmost to cut this down. They need to take it seriously and do exactly what the scientists are telling them, not trying to worry about their own political futures or their pocketbooks.
Right, Mr. Benjamin Neuman, talking that aspect of herd immunity, that building up, not that being the aim, but that being a possible consequence. Also, the fact that we are seeing from tests that the level of antibodies, as you mentioned previously, is extremely low. What does the worst case scenario look like at this present time?
So in addition to those studies that show that the level of antibodies are low in some people, there's that new preprint today that actually shows that the level of antibodies falls off very quickly over time. And it looks as though in order to have herd immunity, first of all, you have to have immunity. And it looks like the immunity to this particular virus may be relatively short-lived. On the order of a few months, possibly a year, but probably not much more than that. And so in that kind of situation, it becomes absolutely essential. I think that was a great point the other commentator made just a moment ago. This is something that needs to be stopped right here and right now. And I get the idea that politicians are trying to go for. They're trying to balance things. They're trying to have nuance and have a little bit of economic activity at the same time, keep the country open, and try to stop the virus. But right now, a lot of things are definitely not happening. The very basic WHO guidelines are that you need to test everybody who may be infected. You need to be able to contact trace. Just call on the phone all of the recent contacts of that person, and you have to be willing to do this. And then you need to be able to isolate people once they are positive. And so you need to be actively going out and checking people who are contacts of known positives. And that's really not happening, not just in America, but also in parts of Europe. There are great parts of the world, in fact, where this is the sort of complacency that's happening, and the consequences could be very drastic indeed, I think.
Right. Mr. Einar, on a similar point, the World Health Organization also stated that the worst is yet to come. What do you mean? What do you think they mean by that? What models and what predictions are they basing that statement on?
Well, quite frankly, this is a world pandemic. And right now we are very concerned. Everything in the news is about first world countries, Japan, South Korea, Singapore, China, the United States, Russia, EU. But the fact is, the majority of the world has yet to experience the full brunt of this. And these are countries that need more help. They do not have the robust medical systems that these first world countries have. So there is expected to be higher casualties. What's necessary right now is for the world to act together. I mean, this is not something where you can hide away and put up walls around your country and then pretend it'll go away. If this virus keeps on going around and around the world, you're going to stunt economic activity. You're going to really send the world back to the dark ages. So it's time for global leadership and enough put away these kind of economic and political games that some countries feel are appropriate to use at this time.
Right. Mr. Tangen, just one very quick last question to you. We have to end, but you are saying this is what needs to happen. Are there any efforts being made to go in that direction, to come up with that global leadership? Is that a realistic expectation?
Not with Donald Trump in the White House, who's made it very clear he distrusts all international bodies. He's already attacked the WHO. He doesn't like the UN. There's just no way with him there. So right now we're looking at a post-Trump reality, and hopefully that somebody will be more interested in the world as well as his own people.
Right. On that point, thank you so much, Mr. Tangen, for your time joining us from Beijing. Mr. Benjamin Neuman for joining us from Texas. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.